Phlebotomy 2026 Phlebotomy Certification Exam Tips. All you need to know. Question 1. Which tube is used for a point/PTT coagulation test? Lavender, light blue, green, red. Light blue tubes contain sodium citrate, which is the additive for coagulation studies. Question 2. What is the correct order of draw for a blood culture, CBC, and point/PTT? CBC, point/PTT, blood culture, point/PTT, CBC, point/PTT, blood culture, CBC, blood culture, CBC, point/PTT. Blood cultures must always be drawn first to prevent contamination, followed by citrate, blue, then EDTA, lavender/CBC. Question 3. Which artery supplies oxygenated blood to the heart muscle, myocardium, pulmonary, aorta, coronary, carotid? The coronary arteries supply the heart itself. Question 4. What is the maximum time a tourniquet should remain on a patient's arm? 30 seconds, 1 minute, 2 minutes, 5 minutes. Leaving a tourniquet on for more than 1 minute causes hemoconcentration and may alter results. Question 5. When performing a dermal puncture on an infant, the preferred site is the thumb, the heel, the big toe, the earlobe. Heel sticks, on the medial or lateral plantar surface, are standard for infants under 1 year. Question 6. A hemolyzed specimen occurs when red blood cells are ruptured, the blood is too thick, the tube is underfilled, the patient hasn't fasted. Hemolysis is the breakdown of RBCs, releasing hemoglobin into the serum/plasma, often due to improper technique. Question 7. How many times should a lavender, EDTA, tube be inverted? 3 to 4, 5, 8 to 10, 15 to 20. Proper mixing prevents microclot formation in EDTA tubes. Question 8. Which component is produced after centrifuging a lavender top tube? Serum, plasma, whole blood, hemoglobin. Anticoagulated tubes, like lavender, yield plasma when spun. Question 9. For a patient with a left-sided mastectomy, where should venipuncture be performed? Left arm, right arm, left hand, either arm. Avoid the side of a mastectomy due to the risk of lymphedema and infection. Question 10. What does diastole refer to in the cardiac cycle? Contraction, relaxation, heartbeat, blood flow. Diastole is the period when the heart fills with blood after contraction, systole. Question 11. A sputum sample is collected from the urine, lungs, mouth, saliva, stomach. Sputum is deep lung secretion, not saliva. Question 12. What is the first step when a patient faints, syncope, during a draw? Finish the draw quickly. Remove the needle and tourniquet immediately. Slap their face. Call their family. Patient safety is priority. Stop the procedure and protect the patient from injury. Question 13. What is the additive in a green top tube? EDTA, sodium citrate, heparin, SST. Green tubes contain heparin, lithium, sodium, or ammonium. Question 14. Which gauge needle is typically used for standard adult venipuncture? 18G, 21G, 25G, 16G. 21 gauge is the standard size for most routine draws. Question 15. The order of draw is designed to prevent patient pain, additive cross-contamination, hemolysis, fainting. It prevents the transfer of additives from one tube to the next by the needle. Question 16. Which white blood cell is most numerous in a healthy adult? Lymphocyte, neutrophil, monocyte, eosinophil. Neutrophils typically make up 40 to 70% of the WBC count. Question 17. When collecting blood for therapeutic drug monitoring, what must be verified? Last meal time, time of last dose, patient's height, shoe size. Peak and trough levels depend on the timing relative to the last medication dose. Question 18. Which of these is not a site for venipuncture? Median cubital vein, cephalic vein, basilic vein, femoral artery. Phlebotomists generally do not perform arterial punctures. Question 19. What is the purpose of wiping away the first drop of blood in a capillary stick? To clean the skin again, to remove tissue fluid contamination, to save blood, to check the color. The first drop contains interstitial fluid which can dilute the specimen. Question 20. What does a fasting specimen require from the patient? No water for 2 hours. No food or drink, except water, for 8 to 12 hours. No exercise for 24 hours. Only clear liquids for 3 days. Standard fasting for tests like glucose or lipids is 8 to 12 hours.